Welcome to the SVG-TV news for Tuesday, March 31st. I'm Khalil Kato with the details. St. Vincent and the Grenadines is said to be the first country in the Caribbean to establish an agreement with the Cuban government to provide the Herbiport P drug to treat diabetic foot ulcers. The announcement on the collaborative effort was made this morning at Cabinet Room, where representatives of both the governments of Cuba and this country expressed their satisfaction with the partnership. The drug, which was developed by scientists at the Center for Genetic Engineering and Biotechnology CIGB in Cuba as a cure for diabetic foot ulcers, contains an epidermal growth factor, EGF, to be applied by injection directly at the wound site. It has been found to promote granulation and healing in advanced diabetic foot ulcers, thus reducing the number of amputations. Angiologist and vascular surgeon Dr. Alberto Carazana described the Herbiport P drug as a big weapon in healthcare and said they will be providing training to medical practitioners here in the use of it.
Es una gran arma.
It is a big weapon
en nuestras manos
in our hands
para poder ayudar a estos pacientes
to help these kind of patients.
Y que creo que San Vicente,
and I believe St. Vincent,
que va a ser el primer país del Caribe
is going to be the first country in the Caribbean
en tener este medicamento,
to have this medication available.
Pues le va a ser de gran ayuda,
which is going to help them a lot.
Y nosotros estamos en toda la disposición
and we are in the disposition
de contribuir
to contribute
con todas las autoridades de salud pública
along with the health officials
a transmitir nuestra experiencia,
to pass our experiences.
Prime Minister Dr. Ralph Gonsalves says the initiative also goes hand in hand with the Lives to Live program to help those in need. He says he was pleased to collaborate with the Cuban government to supply the drug and says even CARICOM recognizes that diabetes has a terrible impact on the region.
The fact that we are seeking to treat this medical condition doesn't mean that we must take diabetes for granted. We still have to make sure that we eat properly and drink properly, and to be very careful and to exercise, to be very careful, and especially if you have a predisposition towards diabetes. So this is a very important message, because diabetes and hypertension, they are among the biggest killers, not only in St. Vincent and the Grenadines, but the Caribbean.
The Prime Minister pointed out that the program will run initially for 5 years. He says that each vial treatment costs $370 and patients may need 2 to 4 per week. The total cost is $222,000, although the drug is being heavily subsidized.
This is a program which we are signing here for 5 years, but we're doing it on an annual basis. And we anticipated that in the first 12 months, our target will be to treat 50 persons, which would cost us, just for the drug itself, not talking about the doctor's skill and the care with nurses and all the ancillary support staff and services provided. I'm just talking, this is just on dealing with the supply and distribution agreement. This would cost us $222,000 for 50 patients.
Meanwhile, surgeon at the Milton K2 Memorial Hospital, Dr. Barriozzi, says the treatment results of the Herbiport P drug is very impressive. He, however, noted that not everyone will qualify for the drug, which will ensure that those suffering from severe diabetic ulcers will receive the medicine.
As the Prime Minister mentioned, this is a very expensive drug. So we need to use it wisely. That does not mean we want to prevent it for anybody, but we want to give it in its right indication. That means if we tell a patient that you don't need this medication, we don't prevent you from getting it. That means the regular treatment will get your way out. We don't want to make it as a waste. We appreciate this medication to come to help the people who need it. So we will use it for people who need it, and we save it for the people who need it only. The people who they don't have the category of using this medication, the regular treatment will work with them. That will be enough, I think.
One of the first recipients of the Herbaport P drug, Mag Tibbles of Sanssouci, says when she heard of it, she had to travel to the Spanish-speaking country for it, despite the cost. Tibbles says she is grateful to everyone who supported her and praised the effectiveness of the drug.
They saw life was in the leg, and they said they will work with the leg. So I believe life was important. So sometimes some of these ulcers life might not be in the leg, and if life is not in the leg, then they can't work with it. But that was what they told her. And so they started to work with the leg. And by the Friday morning, that was the Tuesday, the Friday, they took me to the theater and they cleaned the ulcers that were there, very big ulcers, very big ones. And they also made 3 other incisions on the leg. So on this one leg, I had 5 incisions. But the thing is, the pain, the foot wasn't paining me. But you see the cleaning of the leg, that was the pain. And sometimes I could tell you, I used to give her some grip on, you know?
Minister of Health Clayton Bergen says while the government will do all it can to ensure the needs of the people are met, it is necessary for individuals in society also to do their part to guarantee that they take care of themselves.
Those in the Ministry of Health, I want to commend them highly because they have been working very hard over the many years and they continue to work hard. And I want to urge them to continue to do so and encourage those who they supervise to do so for the people of St. Vincent and the Grenadines. Let them realize who they are working for. It's you, the taxpayers, and other persons, and we want to have a healthy nation. Please look after your health. Your health is your responsibility. We are here to assist you in doing what is necessary for your health. Health is an expensive venture, same like education. And we know the government can't do it alone. So you have to play your part and play your role in this process.
Commending the Cuban people on their innovativeness was Foreign Affairs and ICT Minister Camilo Gonzalez. He says one of the reasons the U.S. government has opened talks with the Spanish-speaking nation is because of its advancement in the biomedical industry, noting that many in the Western world are flocking to Cuba to receive health care.
Very unjust blockade that has been foisted on the government and people of Cuba has forced them to become innovative in a number of ways. And the inability of the Cuban government to purchase a number of drugs that were manufactured in the United States by virtue of the blockade has forced the Cuban biomedical industry and health sector in general to innovate and become self-sufficient in many ways. And they developed, in this case, a drug that is not available in the United States. So and I think the strength of the biomedical industry played some role in forcing the United States to reconsider their relationship with Cuba, because now there are Americans who are trying to get access to Cuban expertise.
The SVG Human Rights Association has expressed concern with 10 deaths at the mental health institution. A release from the association dated Friday, March 27th called for a transparent and thorough investigation into the deaths of the residents at the institution. The media release concluded by saying that members of the society who are mentally ill are vulnerable and great care must be taken in the way they are treated, cared for, and dealt with. Last week, Chief Medical Officer Simone Kieser-Beach told SVG-TV News that they are analyzing the circumstances surrounding the deaths of the 10 patients. The law of St. Vincent and the Grenadines does not protect assets nor ensure time and effort spent in common law unions. That's according to former Registrar of the High Court, Paula David, who was delivering the latest Agnes Cater Memorial Lecture last evening, hosted by the SVG Bar Association at French's House. David says it is important that persons know that the law does not recognize individuals in common law relationships, although these unions are extremely common in SVG.
In St. Vincent and the Grenadines, we have a piece of legislation called the Matrimonial Causes Act. That act tells the court how it can distribute assets when married people divorce. The act sets out the wide powers of the court. Judges read the act, consider what it says, and apply it when people come before them to seek justice. Parliament has not, however, made any law to govern what should happen to family assets when people living in a common law union stop living in the union. In some other Caribbean countries, parliaments, recognizing that the common law union is a cultural norm for us, have put in place laws to govern what should happen to family assets, such as the family home, when persons in a common law union break up.
She says it is difficult to predict what or if anything will be rewarded to persons leaving common law unions, and that given this reality, there is the need for the formation of a new legislation or the expanding of current legislation that divides the assets of married couples, where the initial shares would be 50-50.
It is difficult to predict what, if anything, will be awarded to a party whose name is not on a deed under the law as it now exists in St. Vincent and the Grenadines. My contention then is that we need legislation to clarify the position of persons in common law unions. If we are to all have equality under the law, married people should not be treated one way, while common law couples are treated another way. As it stands, married couples are treated better under the law than common law couples. There can be no justification for this. It is discriminatory. And discrimination, that is, unequal treatment under the law, is unacceptable in a democratic society.
David, who is the senior associate in the law firm Saunders and Huggins, emphasized the need for fair share division within common law relationships.
The relationship between common law husband and wife is a union. But what of the word law? Is that apt? My answer is not so much. When parties to a marriage which has broken down come to us as lawyers to ask what their rights are in relation to the division of assets, we can say with a fair degree of confidence, the starting point is each person gets half of the assets. If you're in a common law union, however, you cannot seek maintenance either in the family court or in the high court. There is no provision under the law for a common law husband or wife to assist the other financially if the partner is in need.
The lecture last evening honors Agnes Cato, who was a pioneer member of the local bar and a staunch advocate of women's issues. A decrease in the food import bill here will mean increased employment for Vincentians. That's the view of Minister of Agriculture Saboto Caesar, who highlighted the need to grow and produce more local food. Minister Caesar was speaking at the closing press conference of the meeting of the OECS Council of Agricultural Ministers held here last Friday. Earlier today, the Central Water and Sewerage Authority Solid Waste Management Team was occupied with trying to locate the perpetrator responsible for dumping a truckload of filth in capital city Kingstown. The solid waste manager, Winsbert Quao, told SVG-TV News that the issue of illegal dumping continues to be of great concern to the CWSA. Quao explains that this latest incident of illegal dumping on the South Leeward Highway in the area of the hospital corner is without a doubt a show of little concern by the perpetrator for the image of St. Vincent and the Grenadines and the preservation of the environment.
Last night someone came and dumped what I would consider about a truckload of material right here on this piece of land. Now, our diamond landfill is open from 6 to 6 from Monday to Saturday, and it is about 30 minutes away from this site. You know, there's absolutely no reason why someone could tell me to justify what they have just done here. It really reflects poorly on us as a country, and the reason why we are here to highlight the problem is that when these things happen, early in the morning people call us at our offices. We're at our offices trying to do work. We have so much work to do in terms of just doing the regular operation itself, and folks will call us complaining, the businesses, that they have this site and we have to come out to deal with it. A totally unavoidable situation. As you will recall, just a few weeks ago we had our free white goods collection service, and there are items of white goods here that could have been easily placed out for collection. We see a fridge, we see old furniture, we see mattresses and so forth. This could have been collected free just a few weeks ago.
Kwao says the CWSA is also seeking the public support in finding the person or persons responsible for committing the act.
We have contacted the police, and we are urging anyone with information to also call the police and give them the details. This is a crime under the Litter Act number 15 of 1991, and I think it's about time our people start seeing it as such. St. Vincent is a very beautiful country. We want to preserve our natural environment, and we have been trying hard for many years just to get Vincentians to comply, to just do the basic things. Put out your garbage for collection on collection day, make use of our white goods service, and just abide with the laws of our country. And sometimes we feel a little bit deflated when we see things like this happening, and it really reflects poorly on us as a country. So we want to highlight it, and we want to ask for the public support. And the perpetrator of this act, we would like you to know that we are taking it very seriously. We have contacted the police, and we're hoping that some action will be taken.
Meanwhile, Public Relations and Marketing Manager at the Central Water and Sewage Authority, Joan Ryan, says they have since gone through the garbage in search of any form of identification that can possibly lead them to the owner of the material that was dumped, and adds that they were successful in their attempts.
There is a name and there is a number on a piece of paper. We can't say that that is the person who actually brought the stuff here, but somewhere along the way there was some connection to that person, so we have taken that name and number, and we will try to contact that person when we get back to the office. The thing about this is this location is on a vacant piece of lot. That person seemed to think it's okay to throw stuff on vacant lots, whether it belonged to them or not. But I just want to warn the public that even though the vacant lot belonged to you, as long as what you have dumped on the lot becomes a public nuisance, it is illegal dumping, and you are breaking the law. If you have dumped it on somebody else's land, it's double. So that also is illegal. The other thing I want to highlight is that this act is taking place right next to a medical clinic and opposite a pharmacy, just above the General Hospital of St. Vincent and the Grenadines. Really, what could that person be thinking?